When blood sugar rises too fast after a meal, most people blame sugar alone. But the real problem is often speed. It is how quickly that food breaks down into glucose and enters your bloodstream. That sudden rise can leave you tired, foggy, hungry again too soon, or craving more carbohydrates later in the day. And if it happens again and again, the body may need to work harder to keep blood sugar under control. This is where food can make a powerful difference. Not because one food acts like a medication, and not because a single ingredient can fix diabetes overnight, but because the right foods can slow digestion, reduce sharp glucose spikes, support insulin response, and help energy feel steadier after meals. In this video, we will look at 10 foods that can help you build a smarter blood sugar plate. Some are simple everyday choices like vegetables, beans, oats, protein, and Greek yogurt. Others, like fenugreek, Ceylon cinnamon, broccoli sprouts, and diluted apple cider vinegar, need to be used more carefully. If you take diabetes medication, do not change your treatment without medical advice. These foods are support tools, not replacements for care. Before we talk about the foods, you need to understand one simple idea. Blood sugar is not only affected by what you eat, but by how fast your meal is digested. When you eat carbohydrates, your body breaks them down into glucose. That glucose moves into the bloodstream, and insulin helps carry it into the cells for energy. When this process happens gradually, the body can usually handle it more calmly. But when glucose rushes into the blood too quickly, blood sugar rises sharply, and the body has to work harder to bring it back down. This is where food can become a powerful tool. The first mechanism is fiber. Fiber acts like a brake inside the digestive system. It slows the movement of food, reduces the speed of glucose absorption, and helps prevent a sharp rise after eating. This is why vegetables, beans, oats, chia seeds, and flax seeds matter so much. The second mechanism is protein. Protein gives structure to a meal. When you eat carbohydrates alone, especially refined ones, they often digest quickly. But when you pair them with eggs, fish, Greek yogurt, tofu, lean meat, or beans, the meal becomes steadier. You feel full longer, and glucose enters the bloodstream more gradually. The third mechanism is healthy fat and acidity. Foods like fatty fish, seeds, and a small amount of diluted apple cider vinegar can slow the meal down. This does not mean adding large amounts of fat or drinking vinegar straight. It means using small, smart additions that support a smoother response. The fourth mechanism comes from plant compounds. Ceylon cinnamon, fenugreek, and broccoli sprouts contain natural compounds that may support insulin response, inflammation balance, and metabolic health over time. They are not miracle cures, but they can be useful when added to a healthy meal pattern. Blood sugar control is rarely about one ingredient. It is about the whole plate. Fiber first, protein present, carbohydrates chosen carefully, and the body supported instead of overwhelmed. Now, let's begin with the foods that work like a brake on sugar absorption. The first food group is non-starchy vegetables. This includes broccoli, spinach, cucumber, cabbage, zucchini, cauliflower, green beans, bell peppers, and leafy greens. These foods add volume to your plate without bringing a heavy carbohydrate load. They help you feel full, but they do not hit your blood sugar the way white bread, sweet cereal, or large portions of rice can. A simple trick is to eat a few bites of vegetables before your starch. That one small change can make the whole meal easier for your body to handle. The second food group is beans and lentils. Lentils, chickpeas, black beans, kidney beans, and navy beans are helpful because they contain both fiber and plant-based protein. This combination makes them much steadier than refined carbohydrates. Add them to soups, salads, stews, or use a small portion to replace part of your usual rice or bread. If they cause bloating, start with a smaller amount and increase slowly. The third food is whole oats. Plain oats, especially steel-cut or rolled oats, contain beta-glucan, a type of soluble fiber that helps slow the release of sugar from the meal. But avoid flavored instant packets because many of them contain added sugar. A better breakfast would be oats with unsweetened Greek yogurt, chia seeds, Ceylon cinnamon, and a few berries. The fourth food is chia seeds or ground flax seeds. These tiny seeds can make a meal more filling. Chia absorbs liquid and forms a gel-like texture, while flax adds fiber and healthy fats. 1 tablespoon mixed into yogurt, oatmeal, or a low-sugar smoothie is enough for many people. The main lesson is simple. Do not eat carbohydrates alone. Put fiber beside them or even before them so your body has a better chance to respond calmly. The 5th food is fenugreek, also called methi. These small seeds may not look impressive, but they are rich in soluble fiber, which can help slow the digestion of carbohydrates. That means glucose may enter the bloodstream more gradually instead of rushing in all at once. Fenugreek has also been studied for its possible role in supporting healthier fasting blood sugar and post-meal glucose response, but it should not be treated like a medication. There are a few simple ways to use it. Some people soak a small amount of fenugreek seeds overnight and use them the next morning. Others add ground fenugreek to soups, stews, curries, or warm dishes. The key is to start small. More is not always better, especially if you already take insulin or blood sugar lowering medication. In that case, you should monitor your numbers carefully and speak with your healthcare provider. The 6th food is Ceylon cinnamon. Cinnamon is often mentioned in blood sugar discussions because it contains natural plant compounds that may support insulin signaling. But the type matters. Ceylon cinnamon is usually preferred for regular use because cassia cinnamon can contain higher amounts of coumarin, a compound that may be harder on the liver when taken in large amounts over time. You do not need much. A small sprinkle in plain oatmeal, unsweetened Greek yogurt, coffee, tea, or a low-sugar smoothie is enough for most people. The goal is not to cover every meal with cinnamon. The goal is to use it as a gentle support inside an already balanced plate. The 7th food is broccoli sprouts. Broccoli sprouts are young broccoli plants, and they are especially known for a compound called sulforaphane. This compound is studied for its connection to inflammation balance, oxidative stress, and metabolic health. That matters because blood sugar problems are not only about sugar. They are also connected to how well the body handles stress, inflammation, and insulin response. You can add a small handful of broccoli sprouts to salads, eggs, sandwiches, or a bowl of vegetables. Just remember that sprouts need to be washed and stored carefully. People with weak immune systems should be cautious with raw sprouts. These 3 foods are not miracle cures. Fenugreek, Ceylon cinnamon, and broccoli sprouts are best seen as support tools. They work better when the rest of the meal already includes fiber, protein, and fewer refined carbohydrates. The 8th food is diluted apple cider vinegar. This is one of the most talked about tools for blood sugar, but it needs to be used correctly. Apple cider vinegar contains acetic acid, which may help slow how quickly a starchy meal affects blood sugar in some people. But it is not a cure, and it should never be used like medicine. The safest way is to dilute it. Mix 1 to 2 teaspoons into a full glass of water, or use it as part of a salad dressing with vegetables and olive oil. Do not drink it straight. Undiluted vinegar can irritate the throat, upset the stomach, and damage tooth enamel over time. If you have acid reflux, stomach ulcers, kidney problems, low potassium, or take several medications, speak with a healthcare professional first. The 9th food is unsweetened Greek yogurt. This is useful because it gives you protein with much less sugar than many flavored yogurts. Protein helps slow the meal down and keeps hunger under better control. But the word unsweetened matters. Many fruit-flavored yogurts look healthy but contain added sugar that can raise glucose quickly. A better option is plain Greek yogurt with chia seeds, ground flaxseed, Ceylon cinnamon, and a few berries. This gives you protein, fiber, and flavor without turning breakfast into dessert. The 10th food is fatty fish or clean protein. Fatty fish like salmon, sardines, and mackerel do not lower blood sugar instantly. Their value is different. They provide protein and healthy fats that help make the meal more stable. They also support heart health, which is important because people with high blood sugar often need to protect their blood vessels as well. Other good protein choices include eggs, tofu, chicken, turkey, seafood, lean meat, or beans if they fit your diet. The main rule is simple. Do not eat carbohydrates by themselves. Pair rice, bread, potatoes, or oats with protein, fiber, or vegetables. That combination changes the meal from fast and unstable to slower, steadier, and easier for the body to manage. Now that we have the 10 foods, the real question is how to combine them into meals that actually work. The first rule is to start with fiber. Before the rice, bread, pasta, potatoes, or fruit, begin with non-starchy vegetables. This could be a small salad, cucumber slices, steamed broccoli, spinach, cabbage, or green beans. You are not eating vegetables only for vitamins. You are using them to slow the meal down and give your body a calmer start. The second rule is to never let carbohydrates stand alone. A bowl of oatmeal by itself may still raise blood sugar quickly for some people, but oats with Greek yogurt, chia seeds, ground flaxseed, Ceylon cinnamon, and a few berries becomes a very different meal. It has fiber, protein, and plant compounds working together. The third rule is to include protein in every main meal. At breakfast, that might be eggs, tofu, Greek yogurt, or fish. At lunch, it could be chicken, beans, lentils, tuna, or turkey. At dinner, it may be salmon, sardines, lean meat, tofu, or another protein that fits your health needs. Protein gives the meal structure and helps keep hunger from returning too soon. The fourth rule is to use support foods carefully. Fenugreek, Ceylon cinnamon, broccoli sprouts, and diluted apple cider vinegar can be helpful additions, but they should not all be forced into the same meal. Choose one or two that make sense. For example, cinnamon works well with oatmeal or yogurt. Broccoli sprouts fit better with salad, eggs, or a vegetable bowl. Diluted apple cider vinegar may be used as salad dressing before a starchy meal. Here is a simple blood sugar-friendly breakfast. Plain Greek yogurt, whole oats, chia seeds, ground flaxseed, Ceylon cinnamon, and a few berries. For lunch, leafy greens, broccoli sprouts, grilled chicken or tofu, lentils, and olive oil vinegar dressing. For dinner, salmon or another clean protein, cooked vegetables, and a controlled portion of slow carbohydrates. The goal is not a perfect plate. The goal is a smarter combination that helps glucose rise more slowly and keeps energy steadier after eating. Now let's turn these foods into a simple plan you can start tomorrow. Step 1. Choose one meal to improve first. Do not try to rebuild your entire diet in one day. That usually creates stress and makes the plan harder to repeat. Start with breakfast, lunch, or dinner. Pick the meal where your blood sugar usually rises the most, or the one where you feel tired and hungry again too soon. Step 2. Add protein before you add more carbohydrates. If breakfast is usually toast, cereal, or sweet coffee, bring in eggs, plain Greek yogurt, tofu, fish, cottage cheese, or another protein that fits your body. If lunch is mostly rice or bread, add chicken, beans, lentils, tuna, turkey, or tofu. Protein gives the meal a stronger foundation. Step 3, eat fiber before starch when you can. This is one of the easiest habits to practice. Take a few bites of salad, cucumber, broccoli, cabbage, spinach, or green beans before rice, pasta, potatoes, or bread. You are not removing carbohydrates, you are changing the order so the body can handle them more calmly. Step 4, choose one support food. Do not force all 10 foods into one day. Choose one small tool that fits naturally. Add chia or ground flaxseed to yogurt. Sprinkle Ceylon cinnamon into oats. Add broccoli sprouts to a salad. Use diluted apple cider vinegar as a dressing if your stomach tolerates it. Try fenugreek carefully, only if it is safe for your medications and health condition. Step 5. Move gently after eating. A slow 10 to 15 minute walk after a meal can help your muscles use some of the glucose from the bloodstream. This does not need to be exercise in the intense sense. It can be walking around the house, pacing in the hallway, or taking a calm walk outside. The goal is not a perfect day. The goal is one better meal repeated often enough that your body begins to recognize a steadier rhythm. Before you try this plan, there is one warning that matters more than any food on this list. If you already take insulin, sulfonylureas, or any medication designed to lower blood sugar, you need to be careful when changing your meals. Food can support your body, but it can also change how strongly your medication affects you. When you eat fewer refined carbohydrates, add more fiber, use fenugreek, sprinkle cinnamon, drink diluted apple cider vinegar, and walk after meals, your blood sugar may drop more than expected. That does not mean these habits are bad. It means they should be used with awareness. Low blood sugar can be serious. Watch for signs such as shaking, sweating, a fast heartbeat, sudden hunger, dizziness, weakness, confusion, blurry vision, or feeling unusually anxious. Some people, especially those who have had diabetes for many years, may not feel clear warning signs until the number is already low. This is why monitoring matters. If you use a glucose meter or continuous glucose monitor, pay attention when you change your diet. Notice what happens after meals, after walking, and after adding new foods like fenugreek or vinegar. Also, do not stop medication or reduce your dose on your own. If your numbers improve, that is a conversation to have with your doctor, not a decision to make alone. Extra caution is needed if you have kidney disease, liver disease, stomach ulcers, severe acid reflux, low potassium, or if you take blood thinners or several prescriptions. Pregnant women and older adults with multiple health conditions should also ask for medical guidance before using herbs, supplements, or vinegar regularly. The safest blood sugar plan is not the most aggressive one. It is the plan that works with your treatment, your body, and your real life. The final lesson is simple. There is no single magic food that fixes blood sugar overnight. Real control is built through the way your meals are put together, repeated day after day. Non-starchy vegetables help slow the meal down. Beans, lentils, oats, chia seeds, and ground flax seeds bring fiber that makes glucose rise more gradually. Fenugreek, Ceylon cinnamon, and broccoli sprouts may offer extra support when used wisely. Diluted apple cider vinegar can be helpful for some people around starchy meals, but it must be used with caution. Greek yogurt, fatty fish, eggs, tofu, and lean protein give the plate structure, so carbohydrates do not hit the body alone. But the most powerful strategy is not just eating these foods, it is combining them correctly. Start with fiber. Add protein. Choose slower carbohydrates. Use support foods carefully. Then move gently after meals if it is safe for you. This is how blood sugar becomes more stable, not through fear, restriction, or chasing quick fixes, but through a rhythm your body can trust. Start with one meal tomorrow. Add vegetables before the starch. Put protein on the plate. Replace one refined carbohydrate with a slower option. Take a short walk after eating. Then notice how your body responds. You do not need a perfect diet to make progress. You need consistent choices that support your energy, protect your focus, and help your blood sugar feel steadier from one meal to the next.